Hi, everyone. Super Bowl champ Vernon Davis here from Legal Help Center. If you've been injured in an accident and think you deserve compensation, listen up, because we have legal professionals standing by right now to answer your questions for free. You can find out if you have a case and how much it's potentially worth.
Thanks, Vernon. You heard it, folks. If you've been injured, call and find out how much you qualify for. Call 800-497-4410. Advertisement sponsored by Legal Help Center. May not be available in all states.
And welcome to another edition of your favorite Medicare podcast with your favorite Medicare podcast host, Toni King. So, Toni, today you get a question from Phoenix, Arizona that says, I picked the wrong Medicare Advantage plan. When can I return to original Medicare? So it goes like this. It says, Toni, I never should have listened to my brother who bragged about how his Medicare Advantage plan was a great way to save money and not have to spend so much on my Medicare supplements plan's premium. I discovered that the eye doctor who was to perform surgery on my right eye in early January is not in this plan. I should have called his office before I signed up for the HMO plan. Now my eye surgery is postponed since the doctor's office is requesting that I return to original Medicare to do the type of surgery that is needed. Can you explain how and when I can return to original Medicare? I'm glad I had not canceled my Medicare Supplement Plan G, even though the premium has increased. Signed, Christina from Phoenix, Arizona. So what do you say, Toni, about that?
I say Christina was the first thing she did that was smart is that she did not cancel her Medicare Supplement Plan. She wanted to wait until she could try this. We tell everybody that goes with an Advantage plan during Medicare's AEP, don't cancel your Medicare supplement until you make sure this is going to work, because it's a hassle. There's a lot of paperwork that needs to be done. So she did something that's very smart by not canceling, but she should have called every one of her doctors before she signed up. And one thing people need to know is that when you go with an HMO versus a PPO, your out-of-pocket may be less, but you have less doctors to go to. So, you got to research this. Don't listen to the person on the other end of the phone that's trying to sell you something. Or if you have a friend or a family member like her brother that thinks they know everything, do some research first before you have to change. Medicare gives you from October 15th through December 7th. Check it out. Because after December 7th, when you make that change, she's in big trouble. She's not really in that big of trouble, but now she knows I've got an Advantage plan. I need to go back to my Medicare supplement. So on page 72 of the Medicare and You handbook, it discusses how you can change during this period. And Medicare has a period from January 1st through March 31st that's called Medicare Advantage Open Enrollment Period. And that's where you can either change from one Medicare Advantage plan to another, or you can go back to original Medicare. You can't just enroll in a prescription drug plan if that's all you need to change. That's not that time. You can't do that. So I changed my prescription drug plan during Medicare's annual enrollment period, AEP. You do too. That's from October to December if I have to change. Hers is getting out of that Advantage plan. So she's got some little things to do to get out of the Advantage plan. And we can talk about that in a little bit, can't we, Jim?
We can. You're listening to Medicare Moments. Toni King is the host of Medicare Moments, giving you great advice on ways you can navigate the maze of Medicare. Toni is an author. She is published nationally in newspapers all across the land, and she has a great website that's there. It's a resource for you, tonisays.com, TONISAYS.com. And we'll be back right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to Ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments with Toni King. Today we're talking about what happens if you picked the wrong Medicare Advantage plan and what your options are to change to get you something that will be much better for your needs. Toni?
Well, what Christina needs to do is she needs to research which Medicare Part D plan is going to be her best plan to go with. And that's what will pull her off of the Medicare Advantage plan. That's the only time you can enroll in one. If you need to get off of it, she'll go back to original Medicare. She doesn't have to sign up for a Medicare supplement because she's already got one. But the Medicare Part D plan will change it at that time. But let's just say you decided you wanted to do this anywhere from April through October 15th. You know, you kind of want to make a change. You got that Medicare Advantage plan, and now you want to get out of it. You can't. You're locked in. You've only got these 3 months, January, February, and March, to make that change. If she waited until June, July, August, September, she'd be stuck until Medicare's annual enrollment period. So it's very important to know what you're going to do, because after March 31st, you're in what's called a lock-in, and you're locked into whatever Medicare Advantage plan you pick, unless you call Medicare and explain to them that you've really got a situation and let them disenroll you instead of you disenrolling yourself. So it can be real critical after that time. And Medicare's number is 1-800-633-4227. I've got that memorized. 1-800-MEDICARE is Medicare's number. Like we tell everybody, please, if you're coming off a Medicare supplement, give it 3 months. January, February, March. Make sure it's what you like, that you like that Medicare Advantage plan. Try it, because after March, you're stuck.
And you're stuck for the year, basically. And
right.
Then you have an opportunity again in 12 months to readjust. But that year can be painful financially. It can be painful in other ways, especially if you need a medical procedure that's not covered because the doctor or the organization isn't in the HMO. And we've seen a lot of that happening, right, Toni?
I see it all the time. I see it. We had a gentleman come in the office during AEP, and he's at stage 3 of kidney failure. You're not going to be able to meet the underwriting for a Medicare supplement. He's on a HMO Medicare Advantage plan. He's in big trouble. But we were able to help his wife. Call us. We can do Medicare consultations either in person or by Zoom. The rules are the same in Alaska for enrolling as it is in California, Texas, Carolina.
832-519-8664. 832-519-8664. If you think it's better if you explain it and write it, you can send an email to Toni, info@tonisays.com, info@tonisays.com.
We have people that send us a little email. I need help with this. And we have somebody that will send us a whole book and tell us 2 or 3 pages what their issue is. So we get it in all sorts of situations, okay? So call us and we can guide you through it. So I just want to tell you, thank you, Jim, for all you do.
Everybody, thank you for joining us for this edition of Medicare Moments. Toni, back to you.
And I will see you later.
Hi, I'm Toni King, host of Medicare Moments podcast. Join me every Wednesday as I share tips, strategies, and little-known facts I've learned over the past 20-plus years. I put Medicare into people terms, and I want to help you personalize your Medicare, because with Medicare, it's what you don't know that will hurt you. Medicare Moments is available now anywhere you listen to podcasts.